So as you all can see, your boy's still in the hospital. Stayed the night here because I have a PET scan scheduled for this morning. And also, I was still under the anesthesia, which they won't let you leave unless you have an escort for your own safety, which I'm glad they have that in place because I probably would have taken off. Even though I don't think anything would happen, I still would have went back to the hotel. Probably eaten something and screwed up today's procedure, which is finally the PET scan. We don't want to do that. So, yeah, we got a busy day today, so let's go. What's good, beautiful people? So a lot has happened in the last hour and a half, and I didn't get to include you guys. So my PET scan time got moved up, so I just got back from get my PET scan done. Now this.
They took your dad's blood pressure cuff too.
They took what?
The blood pressure cuff.
Yeah, they took everything.
Buggers. Okay, I'll be right back.
All right.
Tell you.
So, yeah, I got a phone call saying that I was late for my PET scan. Well, my PET scan was scheduled for 10:30. At 10 o'clock, I got a call saying I was late. It was supposed to be at 9:30. When I double checked, time said 9:30. The staff here on the floor had it listed for 11, so it was a bunch of confusion. And they ended up rushing me down so that I didn't miss it again. And unfortunately, I was unable to grab my camera to record the process with you guys. So that's probably going to be several hours or maybe even a day, half the day before it's reviewed. But basically, the PET scan will reveal whether or not there's any other cancer in my body or if it's just isolated to my tonsil. Hopefully, it's just isolated to my tonsil, and Dr. Anderson will get those results and we'll go over them together. That, along with the procedure that she did yesterday, will determine my next course of action. Now, if she feels that she can get behind the tonsil and remove it, and that will take care of the cancer, we may not go with either radiation or chemo. However, that also is still in the air because the oncologist said that he would probably recommend some type of chemo anyway, which I'm not really opposed to, even if it's determined that the cancer is not anywhere else. I don't know. I just, some stuff I got to think about and pray about. But I just want to make sure that this poison is eradicated from my system. But right now I'm waiting for this nice nurse to come back. She's going to take my vitals, and they're contacting Dr. Anderson to see when she will be ready to see me, because something else she needs to do is, and this is why the oncologist was saying what he was saying, is the tonsil is right up against one of my lymph nodes. So they're going to do basically a biopsy of that lymph node to make sure that it hasn't been contaminated. Now, as long as that hasn't... Japanese?
For me?
Yeah.
That part? Like, cause they show.
Yeah. I live in Japan. That's why.
Yeah.
But yeah, depending on whether or not that lymph node has any poisoning in it, will actually lead me directly toward some type of chemo or radiation therapy. So hopefully it hasn't been contaminated. Oh, you can go ahead.
Real quick. Okay, sorry.
So yeah, hopefully that's not been affected, but we don't know because the tumor's so close to that lymph node. But we'll find out after we do the biopsy. Those three things combined will determine my next course of action. So we'll see what happens. Well, all right, ladies and gentlemen, things are moving so quickly. As you can see, I'm dressed now, and I'm headed down to meet with Dr. Anderson so we can discuss what the plan is for tomorrow. I'll double check with her, make sure we can record. But yeah, things are moving rather swiftly, which is a good thing. Okay, I need to figure out where I am now. Man, sweet. This mountainside. I'll tell you, this hospital is confusing. Let's see. Yeah, going the right way. So we're going this way. But we won't know everything until the results of the PET scan come back. I'm assuming they're not back yet. I could be wrong. The lady told me it'd probably take a couple hours for them to come back, and it's only been about 30 minutes. So I don't think the results are back yet. But that's going to determine pretty much everything as far as the next course of action. But going right through those doors, and I will catch you guys in a minute. All right, ladies and gentlemen, we are now in the waiting area, waiting for Dr. Anderson. I'm telling you, it's been a long, long day, even though I woke up here at the hospital. I guess that's what makes it long. The fact that I woke up here at the hospital, went and got the PET scan done. And then after the PET scan, because the PET scan took like 2 hours. It took 2 hours. Because first they have to inject the solution. I forgot what it's called, but basically it just makes all of your internals glow. They inject that into you, and then you have to wait for like 45 minutes and some change. But, of course, there's the whole check-in process, and then they do the actual scan itself. The scan took about 30 minutes. But once that was done, I headed down here to the ENT, and I'm telling you, the amount of people in here is crazy. Let me clean this screen off for you guys. So there was a pretty long wait. Now, my appointment was supposed to be at 11 o'clock this morning, but due to the fact that things kind of intertwined with one another with my appointment here with Dr. Anderson and my appointment to get the PET scan done. They kind of overlap one another, so that put me down here with Dr. Anderson a little later than I should have been. So I've just been patiently waiting to get my turn, so to speak. It's like double Dutch. I'm out in the waiting room just waiting for my name to be called. But we're finally here. Once she comes in, I will make sure that I get her permission to record our interaction so that I can bring it to you guys. I'm not sure if the results are back from the PET scan yet. They said several hours. I'm hoping they're back so we can go over those and determine what's next. But tomorrow, we still have, I'm thinking, so I'm just speculating at this point because I haven't spoken with her. I'm thinking we'll go in and do the surgery because it's scheduled already. But with the procedure that took place yesterday, combined, I know my beard looks a mess. I hadn't combed it out or nothing because really I don't give a damn. But combined with what the PET scan will show today will determine whether or not she can get all the way behind the tumor to remove it, and whether we have to worry about it doing excess damage. Because if it's going to do excess damage, then that's where the oncologist comes in, saying that if we cannot get all the way behind the tumor and not cause too much damage, then the best solution would be to go with chemo and radiation. He's also concerned with one of my lymph nodes that's sitting very close to where the tumor is. Now, it doesn't mean that that lymph node is infected. We were supposed to do a procedure where she was going to literally $150 me. If you guys know what that means, if you've been in prison or know anyone who's been in prison, $150, basically, that's a cut from here to here. But she was going to do it from here under my ear across to, I think, like right here. And I open this up and pull out some of those lymph nodes to see if they've been contaminated. Now, the lymph node that is relatively close to the, well, actually, it's right up against the tumor. What we're going to do tomorrow, she's going to stick a needle in it and extract some of the fluids out of it to see whether or not it's been affected instead of actually doing the cut. Now, that's as of right now. Things may change based off what comes back from the PET scan. Because as I said, I don't know right now at this point because I haven't spoken with her since the PET scan was conducted. So we'll just sit here and wait for Dr. Anderson to come into the room. Like I said, I will have to get her permission to record again. And if not, then I'll fill you guys in later. But I'm sure it probably won't be an issue because she let me do it before. So you guys just stay tuned and I will update you or turn the camera back on once she gets here. Okay, so what are the results?
Well, I can't see the pictures yet.
Oh, okay.
And that may take a little bit of time
All right.
to see the pictures and get the full results. What I think is a more pertinent discussion right now is seeing that we have you scheduled for surgery in less than 24 hours,
yes.
Right? What we want to do about that and what I found in the operating room when you went to sleep.
Okay.
So your tumor is it's a fairly good size. You know, we had previously looked at your CT scan and kind of staged you as a T2 tumor, 4 centimeters or less. I think the tumor has grown since your scan in March. So it's probably about 5 or 6 centimeters. I was able to get the retractors in there, and breathing tube went in okay with our excellent anesthesia team. And the top part of the tumor, as I was kind of moving it around, it felt nice and mobile. And I thought, okay, you know, this I could probably get what I would consider to be an acceptable margin on. Lower down, where the tumor, where the tonsil and the tongue base meet, that was definitely a harder area to get around. And my concern for doing surgery is I'm not entirely confident that I could get clear margins on that area. And I guess no surgeon is ever confident 100%, you know, to say absolutely positively, I can guarantee you that I'm going to get around this tumor and that you're not going to need additional therapy. I'm not going to have to take you back for more surgery or give you chemotherapy. But that was my concern as I looked kind of at the bottom of the tumor is, you know, I think with your anatomy and how this has grown some, I think probably less than 50-50 chance that I would, you know, confidently say I would expect clear margins.
Okay. So,
what we do from here is, you know, is somewhat based on here I am in the middle of the summer. Are you a professional videographer?
I do videography.
Do you?
If you need me to stop it, I can stop it anytime.
No. So what we do from here, you know, leaning on primarily surgical therapy or non-surgical therapy, is a lot of my impressions and a lot of your preferences.
Okay.
If it were me as a patient, I might prefer to proceed with the fewest mechanisms of treatment possible, which would probably be non-surgical therapy, right? Radiation and chemotherapy. And that's me kind of knowing just how patients heal and tolerate 3 different modalities. So if you go through the surgery, you have a neck dissection, then you have a big tonsillectomy, then you get radiation plus the chemotherapy. That's a lot to go through, and that's a really big hit.
Okay.
If you are young and healthy and a little bit more risk tolerant, and you say, hey, I've done the talking and the thinking with the other doctors. There are a lot of people who just have this bent, like, I do not want chemotherapy, and I know that. I've had some other family members, I get this a lot. I've seen other people, you know, not tolerate chemotherapy well. So I'm going to do everything in my power to avoid the chemotherapy, even if that means, you know, go through a surgery that might end up with positive margins, and, you know, they're willing to tolerate that risk. Then sometimes we proceed with the primarily surgical route. Do you have thoughts or preferences?
So, if you can't get those margins, approximately how much of the tumor would you be able to remove?
So most of the tumor, but if you're doing a cancer surgery and you don't get it all,
there's no point
this is kind of our theory, right? It's all or nothing, right? So you, especially if it's a surgery that causes the patient, you know, a fair amount of morbidity and risk, right? So this is different than me shaving a tumor off of the top of your thigh, right? Because that's, you know, it's going to heal in, you're going to have some aesthetic defects and such, but ultimately long term that wouldn't affect you. taking out tissue from the back of the throat,
Right.
and the tongue, like that could, can permanently change the way you swallow and function. And it's a really rough recovery period with, as we talked about, a fairly significant risk of you having things that happen afterwards that require you to stay really close to the hospital, feeding tube, potential bleeding issues. We got to keep you really close for those sorts of things. So anytime you put a patient under that risk, you want to feel really good that it's going to be worth it.
Yes.
For the patient, right? And this is really, this is hard for me. It's a hard conversation to have with a person, to say that, I just don't know as a surgeon if I can do what needs to be done, right? I wish I had a magic 8-ball that could tell me the margins. And I think maybe if I had met you in March,
it would have been probably margins would have been better.
Yes, I think my degree of confidence in getting around your margins would have been higher. I'm also a conservative surgeon. There are some surgeons that are more on the aggressive side, and they'd say, let's just go for it, and that's not my personality type. I like to kind of have everything lined up as much as possible. And maybe that means sometimes I don't operate on a person that could have been operated on. I don't know. When I go to heaven, I'll look at all these, and figure out, like, was my decision right or wrong? I don't know. But I do feel like, every patient that I take to surgery, I want to be as honest as possible and say, I think there's a fairly high chance that even if you did surgery, you might still need
chemo and
the radiation and the chemo. And part of that is the size of the tumor. Part of that is your anatomy. You've got a bigger tongue, and that's just how you're made. And
okay.
Part of that's just not controllable, right?
Right. Okay. So this is something we need to decide basically today.
Well, I think it would be best to have the decision before you leave here. We could cancel surgery morning of tomorrow too. That's fine. And we had previously talked about, there might be a role for just doing the neck dissection, taking out those lymph nodes, and even not taking out the tonsil part. But in general, that's not the standard of care.
Right.
The standard of care.
If I'm going to just go with chemo
Yes.
and it's going to take care of it anyway. So.
Exactly. Yeah. Exactly. One thing, I talked to Dr. Padro about you. He was the radiation doctor that you met. And one thing that he said he would like to know is he was looking at the CT scan and saw
how close that was to the lymph node.
Yeah, he was looking at the lymph node, and that, I agree, that lymph node does look a little suspicious. I can actually pull an ultrasound in here because I didn't ultrasound you when I met you last week. It might be helpful information to have to put a needle in that. I do those here in the clinic all the time, although today my needle biopsy folks have left already for the day, unfortunately. They typically are around until about 2:30. That is something we can always do another time. Even if you don't have surgery, if we decide, hey, we at least want to know the status of that lymph node, just kind of like for accurate staging. Okay. That's what Dr. Padro suggested. Right. It's like helpful information to have. Then we can absolutely do that. Like I could try to knock that out tomorrow and at least have that.
Okay, because right now we can't even determine what the stage is, right?
Yeah, it looks suspicious, and I would stage that as a positive lymph node, just kind of how it looks. But if you wanted to have every
I
data
want
point,
confirmation.
then it's easy enough to do a needle biopsy of that. So,
Okay.
so why not? I would say, well, one reason why not would be if you're already going to have a neck dissection, then don't do it because you're going to take it out anyway. But if we're not going to do surgery, which sounds like we're probably leaning not to, then yeah, get that data point.
Okay.
Because that would be just a good thing to be aware of.
All right. It's a hard decision.
Yeah.
But I have true faith and confidence in you. And if you're telling me that it's 50-50 and probably you can't guarantee it, then I guess I have to go to chemo and radiation route.
That's what I would recommend. Just being somebody that really hates to put people through a surgery
Unnecessary surgery.
Yeah, that I don't feel confident is going to get everything, especially if you're able to get that set up. That's another question, right? Like,
yeah, well, probably what I end up doing is I'll probably end up just setting it up in Guam.
Okay.
And do it before I go.
Okay.
Because if I can get everything taken care of here and have the VA get all of this information out to the clinic in Guam, and they can get me in, get me fitted for my radiation mask and get everything done, then I'll just do it that way.
Okay. Do you know, have you had any consults?
I haven't had any consults in Guam.
Okay.
When I did the biopsy through Naval Medical Hospital, they put everything in the system. So the VA has access to it.
Okay.
But they haven't set me up. They sent me straight here.
Okay.
I would have to get a consult, I guess, on the other side when I get back to Guam.
Yeah. Hopefully that could happen in a
relatively soon.
In a timely manner.
That's what I'm worried about, because if this thing has grown that much in 2 months and it takes them a while to get me in, what is it going to look like then?
Well, it does seem to me that usually the VA liaisons, forgive me, how much, I don't know actually if you have VA liaisons because you're retired.
Yes, I have VA liaisons as well.
You do? Okay.
Yes.
A lot of times they can push things, and I'm happy to send emails and kind of lean on them and say this is not something to be sat upon.
Okay. As a matter of fact, Guam's main liaisons or office is here in Hawaii.
Oh, okay.
It's through the VA here in Hawaii.
Okay.
So.
Okay. Yeah. So I know some of the people in the VA office here that I'm happy to email.
Yes, if you could, please.
As soon as you leave, we can set that up.
Okay.
Yeah.
Okay. I'll trust you, and I value your profession. So I'll go to chemo and radiation.
Okay. All right. Well, I thank you for coming out here and
thank you.
Trusting me to take a look, and I wish I could fix the problem, and
you can't win them all, Doc. I know you want to, but I mean.
Yeah. I want you to get better and have a long, healthy life, and with your overall outcomes are going to be pretty good. You are still going to deal with some changes to your speech and swallow and dryness, etc. And I'm happy to, sometimes people will come back and I'll be part of the cancer surveillance team and things like that after treatment. So if you have a reason to need to come back here, I'm always happy to continue to weigh in on your care, even though I'm honestly, half the patients I saw today didn't operate on, but I'm a part of their, cancer team. So I see them a couple times a year, sometimes every other month, to put the camera down the nose and things like that. So if there's a way I can help with that, happy to. As far as evaluating that lymph node, would you, if we're not going to operate tomorrow, we'll handle all the paperwork. Would you be free to come by tomorrow for me to try to do a new biopsy? Okay. What about mid-morning tomorrow?
Okay. You tell me what time to be here and I'll be here.
How about... How about 11?
Okay.
Is that okay?
All right.
I'll let the nurses know that we're going to do a needle biopsy. And
do I need to fast?
No.
Oh, okay.
You don't need to fast. And that will also give us time to follow up on the PET scan.
Okay.
So I would anticipate they'll at least have pictures up and we can kind of close the loop that there's not some surprise that needs to be dealt with.
All right.
So, reasonable?
That's reasonable.
Okay.
Thank you.
All right.
Well, ladies and gentlemen, you heard it. Unfortunately, she's not going to be able to get the entire tumor out because it has grown a little bit since all of this started. So we're gonna go with the, tripping and shit, there's nothing there. We're gonna go with the radiation and chemotherapy, and I can get that done in Guam. Can't say that I'm not disappointed, because I am very disappointed. Not in anything that they've done, but more so the fact that, things didn't pan out the way I was hoping they would pan out. I was hoping that she'll be able to go in, remove the tumor, and maybe not get any chemo or...
Well, he is fine.
Oh, I'm going the wrong way.
He's getting discharged.
Not get any chemo or radiation, but that's not going to happen. Won't be getting it removed. We'll have to just go with the other two options. That's right. I'm outside elevators. Yeah, we'll just have to go with the other two options, which is chemo and radiation. But I do have to come back tomorrow because she's going to do an extraction of that one lymph node that looks a little off. Hopefully it doesn't have anything in it, but if it does, we have to do you know what? Let me go down the other way. This place is so freaking confusing. Anyway, let me figure out where I am and I'll get back with you guys, so stay there. Alright, so we finally found our way out. I'll tell you, the hospital is so confusing. I don't even know how to piece people who work in there figure their way out around it. The directions are horrible. But anyway, like I was saying, unfortunately, she's not going to be able to get around the tumor and get the margins that she wanted. She's only 50% sure as to whether or not she can. And I'm glad she was frank, open, and honest when it came to that, because it helped me make the decision that I've made. Because if we can't get the tumor out completely and forego the other two, I don't want to have to deal with all three. I'm going to reach out to my family, have a discussion with them, let them know what I've decided to do, and we'll push forward from there. So yeah, the plan is to go back to Guam. Now I did ask her, I don't know if, can't remember if I still had the camera running or not, but I asked her about doing the chemo and radiation treatment here. Now one thing I will say as far as Guam, from what I've been told and what I've heard, Guam has a really good, robust program when it comes to chemo and radiation. So I've heard nothing but good things about GRC when it comes to that. So I don't think I'll have an issue with regards to getting the treatment there. But this needs to be a relatively quick turnaround. And the reason being is because you guys are getting this information late. I'll just go ahead and be frank and honest with you. You're getting this information late. And the reason you're getting it late is because of the way I decided to spread these videos out. You're getting this a month and a half down the road. Maybe not that, maybe a couple weeks down the road. But I'm thinking about just doing the chemo and radiation in Guam, vice going back to Japan to have it done. I could go home to Japan to have it done, but I don't want any communication issues as far as, you know, I know that I can get the information conveyed and they'll have all the notes broken down, and I think it would be better for me to do it in Guam, and then I can also still work. But yeah, that's probably what we're gonna do. We're probably gonna do the treatment in Guam. Like I said, I still need to talk to my loved ones and let them know what's going on. By the time you guys seen this video, I've already talked to them, and I'm already back in Guam, and I'm probably in the process of starting treatment. Just keep it 100 with you guys. But yeah, I wish things would have been different. You know, in the time that I got the initial biopsy back in March, the tumor was sitting at about 2.5, 3 centimeters. Right now it's closer to 4.5, 5, which means it's grown in that time frame, and I don't want to be in a situation to where I've got to wait another 2 months before the treatment starts, and it grows another 2 or 3 centimeters. So tomorrow I'll come back here, and Dr. Anderson will check that lymph node, and she'll have the results back from the PET scan. So then we'll be able to identify what stage I'm actually in. Right now, if I were to guess, we were thinking stage 1, but I'm thinking it might be early stage 2, based off the size of the tumor and whether or not that lymph node is infected or affected. Hopefully it's not. Hopefully it's just a tumor pressing up against it that makes it look suspicious. But I'm going to hope for the best and prepare for the worst. So that will probably put me at stage 2, which we can still overcome this. Just means the battle plan has changed. But anyway, I'm not going to keep talking. This has been your boy Khalif Assad. Check it out with another video. Make sure you like, share, comment, subscribe. Click that post notification bell, turn it to all so that you know when I drop a new video. And with that, we're out.
We ready. Who ready?